I want to say good morning to everyone. Thank you for coming out today. I cannot begin to describe my excitement. We have waited a long time for this day.
I can only imagine the number of lives that will be saved and enhanced because of the facilities you were willing to invest in, our organization that you were willing to invest in, and for all of you who helped support us to get approvals to build this facility. We will be eternally grateful.
I've seen it grow from a relatively small place to what it is today and what it will become. And it'll be wonderful. It'll be a beautiful campus of health and vitality, which is a good thing. Up till now, the folks have worked in small, limited space, but with a dedicated professional staff and a great heart.
This hospital and facility is very important to me. My father, Rear Admiral Bob Garrick, had a stroke over 10 years ago, and he came to this hospital, and with the wonderful staff here, both the doctors and the full medical staff, went through rehab, came in a wheelchair, and 6 weeks later he walked out. And I want to thank all of you personally today for that marvelous miracle, is what we'll call it.
Last year, during my football season, like said, I got injured and the pain started escalating really quickly, and I came to Scripps here in Encinitas, and with the efficiency of the medical staff and the emergency team, I was quickly diagnosed with compartment syndrome in my thigh, which was really rare. None of the doctors had seen it. The orthopedic surgeon was called up right away, and within probably about an hour and a half, I was getting wheeled into emergency surgery.
Today we're seeing the beginnings of a new building, and to the Leichtags it was not so much about the buildings and not so much about the equipment that we need, but we looked at these, and I know Tony and Lee would say this today, that they look at these as tools for their honored healthcare professionals. And it was always about those relationships with this tremendous team that supported them throughout their life.
This hospital has really reached its capacity. So nowhere else is this more true than in the emergency department. Over the past decade, the annual visits have increased by over 50%, now to about 40,000 per year. So this critical care building is really going to fill a very large community need. It'll give us the space, the technology, and really the patient comforts that allow us to provide even higher quality care than we do now.
These advances aren't available to us unless the tools and resources are here, and we're the beneficiaries. It's our hospital.
This is the community's jewel, and it's exciting today to see everybody come together after what has been literally more than a decade worth of work to finally turn the ground to build that state-of-the-art facility. We're starting now, and we're not going to be stopped.